Hi, I'm Dr. Bill Lyle and I practice obstetrics and gynecology. I've been taking care of moms and I've been taking care of their babies for over 25 years. Racism. Racism has no place in medicine. None whatsoever. I abhor racism. I have made hundreds of incisions in women. And guess what? Doesn't matter if they are white, doesn't matter if they are African American, doesn't matter if they are Hispanic, it doesn't matter if they are Asian. Once you get through the first few millimeters of skin, every woman is the same on the inside. They have the same anatomy, they have the same muscles, they have the same arteries, they have the same veins. Once you make that incision and you look on the inside, there is no way whatsoever that you can tell, oh, this is the insides of an African American woman, or this is the insides of a white woman. Racism and medicine have no role together whatsoever. So when I saw that the Department of California, Department of Public Health, was paying for billboards in San Diego, which were so misleading. Let me give you the content of some of these billboards. One billboard said, racism hurts your baby long before they're born. And the other one said, our black babies are nearly 60% more likely to be premature due to discrimination. There are risk factors that affect pregnancy. There's no doubt about it. There are risk factors which affect whether a baby is born premature. In fact, there was a study by the American Journal of Obstetrics and Gynecology last year that looked at African American women and looked at white women, which came from the same high socioeconomic status. And guess what? They had similar outcomes. So it wasn't racism, it wasn't their socioeconomic status that affected them delivering their babies early. The journal article said, we need more information, we need more time to study. So in San Diego, and puts up billboards saying that it is racism that are causing these babies to be born prematurely and threatening their lives. There's no evidence of that. But what do we have evidence of? Well, we have evidence that something does affect the lives of African American babies in the womb. And it does kill more babies than are being born in some areas of the country. And what is that? It is abortion. In fact, the New York City Department of Public Health released a report that said between 2012 and 2016, black mothers aborted 136,000 of their black pregnancies. Meanwhile, in that same time period, 2012 to 2016, black mothers delivered 118,000 black babies. Far more babies were aborted during that time period than babies that were born. Is that different from the other races? Sure. Among the whites, Asians, and Hispanics, they had far more babies that were delivered than were aborted. In the African American community, those moms had far more babies that were aborted than were being born. Is that a conflict of interest? Yeah, I sure say that that is a disparaging statistic. In 2014, 36% of all abortions were performed on black women, yet they only make up 13% of the female population here in the United States. And you talk about targeting. 79% of the Planned Parenthood surgical facilities are within walking distance of a minority community. So is it racism that is killing babies? Well, if you look towards the abortion industry and you look towards Planned Parenthood, which was initiated and founded and started by an avowed racist, Margaret Sanger, then yes, Planned Parenthood is being racist in providing these services to these women in these communities. Abortion is not health care. The abortion industry and Planned Parenthood are specifically targeting African American communities and African American women. And in some communities, there are more black babies that are aborted each year than are being born in each year. We criticize the tobacco industry, that they were marketing and they were targeting our kids. They were making flavored cigarettes and they were making vape nicotine tobacco products. And they were trying to get these kids hooked at a young age on tobacco. Well, there is racism in the healthcare industry, but it is not in those that are providing true health care. Racism has no role. Where do we see racism? Racism is all throughout the abortion industry, and specifically Planned Parenthood. If you have any questions or if you have any comments, you can contact me through my website, which is prolifedoc.org. God bless you. Every one of us was created in the image of God at the moment of conception. We treat God's preborn as patients within the womb. We give them blood transfusions. We can do heart surgery and spine surgery. If they are a patient, they are a person. And if they are a person, they deserve our protection. Have a great day.